青蒿素从中药到全球抗疟之光。疟疾是一种全球性传染病，对人类健康造成严重威胁。而青蒿素作为一种从中药中发现的药物，成为了抗疟事业的一颗明星。让我们一起来了解一下它的故事。青蒿素最早来自于中草药黄花蒿 Artemisia annuale， 在20世纪70年代初，中国科学家屠呦呦教授和他的团队发现了青蒿素的独特化学结构，并证实了它对疟疾的疗效。这一发现为全球抗疟事业带来了曙光，青蒿素成为了最重要和最有效的抗疟药物之一。3、青蒿素的作用机制。青蒿素的显著治疗特性源于2个机制的联合作用，激活机制和药物靶点机制，这2种机制结合在一起，产生了特异性极强的药效。此外，青蒿素还在癌症治疗等领域具有广泛的应用前景。4、未来展望。青蒿素的研究仍在继续，科学家们不断探索它的更多用途。我们期待着青蒿素在抗疟以外的领域发挥更大作用。总之，青蒿素的发现和应用是中药走向世界的一部分，也是中国科学家们不懈努力的结果。让我们一同期待青蒿素的未来更加辉煌。青蒿糊脂是一种半合成的青蒿素衍生物，被广泛用作抗疟药。让我们一起探讨一下这个有趣的化合物——青蒿糊脂，抗疟药的奇妙之旅。化学式 C19H28O8， 分子量384.421。作用机制。青蒿糊脂的作用机制类似于青蒿素，它通过干扰疟原虫的表膜线粒体功能，改变其膜系结构，从而有效控制疟疾发作。青蒿糊脂对疟原虫无性体有较强的杀灭作用，特别适用于间日疟和恶性疟疾的抢救。孕妇和哺乳期妇女使用时需谨慎权衡利弊，但研究表明在临床使用中未见明显不良反应。青蒿糊脂可通过静脉注射或口服给药，剂量治疗疟疾可采用注射3日疗法，总量0.9到1.2克，每天肌内注射一次0.3克，重症患者手忌加倍。青蒿糊脂被列入世界卫生组织基本药物标准清单，是最重要的基本健康药物之一。青蒿糊脂这个神奇的化合物，不仅是抗疟药的利器，也是医学领域的一颗明星。让我们一同探索这个药物的奥秘，为人类健康贡献一份微薄之力。
Artesunate comes from a family of drugs known as artemisinin that are established anti-malarial agents. These drugs have been used for more than 30 years to treat millions of malaria patients worldwide. They were initially discovered following a research project initiated by the Chinese government in the 1970s and come from a herb or plant rather used in traditional Chinese medicine called qinghao or sweet wormwood. They have been found to have an excellent tolerability profile when used in malaria patients. But now we're going to be doing further studies to see whether or not these drugs might also be effective in the treatment of cancer. We are planning to run a phase 2 study of artesunate given to patients with colorectal cancer 2 weeks prior to their surgery. The reason for this is because over the last 10 years, there has been over 400 different publications on the anti-cancer properties of artesunate or artemisinins that now require further investigation in patients. We conducted a phase 1 study at St. George's, which was reported in January 2015. In January this year in eBiomedicine. And this was a phase 1 study, so it was a small study and it involved 23 patients. But we basically randomized half the patients to receive artesunate and half the patients to receive placebo. The drug was well tolerated and in actual fact in the patients who received the artesunate we saw only 1 cancer recurrence at 42 months, whereas in the patients that received placebo there were 6 recurrences. We therefore feel that this is obviously an area that requires further investigation to confirm if indeed artesunate can reduce the risk of recurrence in operable colorectal cancer.